Welcome to the systemic pathology edition. In this edition, I'll be focusing exclusively on the kidney diseases, the nephropathology. And as you all aware that the entire kidney disease revolves around with the main topic, the glomerular disease. I think the glomerular disease forms the majority of our discussion in our kidney diseases. Now, this will be mainly a non-neoplastic condition because hardly we have any tumors in the glomerular disease. So basically I will be focusing first on the glomerular disease. Majority, 70 to 80% of the questions in kidney disease are exclusively from the glomerular disease. Now, if you look into the glomerular disease, there are many types of glomerular disease, right? From minimal lesion, membranous, FSGS, diabetic nephropathy, IgA nephropathy, or lupus nephritis. So, you will have plenty of things to go on. So, I will be covering all these things because that's something which is repeatedly asked in the exam in the last 10 to 15 years. Probably if you see the entire 10 to 15 years paper, the majority of the questions obviously from the glomerular disease. Now, you will have some diseases which are coming from the tubulointerstitial disease also, like for instance acute tubular injury or for instance tubulointerstitial nephritis. All these things will be asked in this topic of tubulointerstitial conditions. So that will be the second part of discussion in your kidney disease. Third part is mainly on the most important topic among all the kidney disease, apart from glomerular diseases, your vascular diseases. In that, you will come across the main topic, vasculitis. Vasculitis. So that's a very important topic. I want you to now understand vasculitis will be the very important topic which we'll be focusing on. Now, once you are done with this, we will be focusing on cystic disease of the kidney, right from ADPKD, ARPKD, medullary cystic disease, uremic medullary cystic disease complex, or simple cysts. So, all these things we'll be focusing on cystic disease of the kidney. Then, we'll be focusing on the last part, tumors, renal tumors, including the genitourinary tract tumors like urinary bladder tumors. All these things I will be focusing on this chapter of the entire kidney disease. So that's the basic homework on what I'm going to do in nephropathology. We will be focusing in this fashion. So once you have knowing what I'm going to do, now let's start our journey from the glomerular disease. If you look into the glomerular diseases, the entire glomerular diseases can be approached in a very simple fashion. So let's not get into the point that I'll be focusing with minimal lesion with few points, for FSGS with few points. This is not like that. We'll first get an idea how we can understand any kidney disease, any glomerular disease. For this, you have to learn some basic approach. Now, what is this very important? You should be very familiar with the approach to the glomerular diseases. Approach to glomerular disease. Now, what do you mean by approach? I want you to now understand few things. When we talk about approaches in the glomerular disease, I want you to be first familiar with the idea that we all know kidney, the most important and functional unit of the kidney is nephron. So obviously nephrons are the major functional units of kidney. Now within the nephrons, the glomeruli is one of the main functional part, main anatomical part in your nephron is the glomerulus. So obviously any glomerular disease will impact the function of the nephron, will impact the function of the kidney. So obviously glomerular disease are a very important thing. Now once you know this is a glomerular disease, are very important. Now how we will understand the entire glomerular disease? For this we need to know the first one thing, what are the normal histology? Now you should be familiar with this question, histology of the kidney, histology of the glomerulus. Without knowing histology, you will not understand anything in your kidney disease. Glomerulus means singular. Glomerulus means singular. Suppose when I see many glomerulus, we used to call this one as glomeruli. So glomeruli is plural. So I hope you know the basic difference. Glomerulus means single one, glomeruli means multiple units of glomerulus, glomeruli. So that's the basic idea. So let's understand the histology. In the histology, you should be understanding that any glomerulus will be made up of two things. One, cells. The second one, matrix. Now what do you mean by cells and matrix? For this, I will show you the basic idea what is the glomerulus will look like. So suppose if I am going to draw this as your glomerulus, and I am just focusing on these are the capillary loops going up in your this one glomerulus. So if you see what I have drawn you here is I have given you a clue that this is the Bowman's capsule. Now this part is your urinary space or Bowman's space we call. Now if you see this entire red thing what I have drawn for you, that will be your tuft of capillaries. So this what I have drawn for you, it's basically the glomerular tuft. So keep in mind what I have drawn you here is the entire thing is intercapillaries, where you find all the capillaries are just forming a mass, a mangled network of capillaries. That capillaries are what we call it as glomerular tuft. Now this region what you have here in this, we call it as also one more name, endocapillary region. So that's your endocapillary, where you find the entire thing of capillaries forming a ball-like network. This is like a ball-like network of capillaries. So you have afferent and efferent arterioles which is supplying this entire ball. So presume it's like a flower vase. In the flower vase, in the center portion you have tuft of flowers. Like that you have tuft of capillaries. That is called as glomerular tuft, endocapillary. Now when you see here in the Bowman's capsule is lined by some cells. So when you know them, these are your parietal epithelial cells which are just lining your Bowman's capsule. So we used to call this one as extracapillary portion. We used to call this one as extracapillary region. So I think I have given you a clue. If you see the entire glomerulus has Bowman's capsule, Bowman's space or urinary space, and the space where the urinary space where it is having some cells lining the Bowman's capsule, this is called as extracapillary region. This is called the endocapillary region. So obviously if I have a cells in this place, I am going to call this one as endocapillary cells. If I have cells coming from in this place, I am going to call this one as extracapillary cells. So I think we have learned extracapillary, endocapillary. Now once you have learned this basic idea, this is how the glomerulus will look like. Now what are the normal cells? I can classify the cells into two main types. Main types as endocapillary cells. Then I can say extracapillary cells. So I think we have now got into the type of cells. There are two types of cells in your glomerulus, endocapillary, extracapillary. What are the cells in your endocapillary cells? Now in endocapillary cells we have mainly endothelial cells. Why endothelial cells? It's a common sense, because I told you it's a tuft of capillaries. Any capillary should be lined by endothelium. So obviously endothelial cells will be there. Second one, you will also have the cells which is supporting the entire tuft. We call it as mesangial cells. Mesangial cells. Then third one, we do have a cells called as a visceral epithelial. Visceral epithelial cells, also known as podocytes. Podocytes. So I think we have learned endocapillary region as three type of cells: endothelial cells, mesangial cells, visceral epithelial cells, or podocytes. Now what are the cells we have it in extracapillary? Extracapillary, there is only one cell. I told you that cell is called as parietal epithelial cells. Parietal epithelial cells. So I think we have now got a basic idea. Any cells in your glomerulus can be classified as endocapillary, extracapillary. Endocapillary are endothelium, mesangial and podocytes. Extracapillary we have parietal epithelial cells. Now what about the matrix? In the matrix, there are two type of matrix. I think let's borrow idea from general biology or general pathology. We have said any matrix in your body, we used to call it as two types. Basically as interstitial matrix, basement membrane. So what is interstitial matrix? Interstitial matrix is the basic stroma which is supporting the layer of epithelial cells. That layer of cells, layer of matrix which is supporting the epithelial cells are called as basement membrane. So both basement membrane and the stroma, we used to call it as matrix. We used to call it as extracellular matrix. Likewise, in the glomerular tuft, we have such matrix which is supporting the entire framework. With your tuft, we call it as mesangial matrix. We used to call it as mesangial matrix. Now what else is found in the glomerular tuft? If I see the entire tuft, what else you see in the matrix? There is one more matrix we all know, which is the capillary wall, capillary loop. We used to call them as glomerular basement membrane. Glomerular basement membrane. Glomerular basement membrane. We used to call it as GBM, glomerular basement membrane. So I think we have got both the answers. In any normal histology of the glomerulus, we have cells, matrix. Cells we said endocapillary, extracapillary. Matrix we said mesangial matrix. Glomerular basement membrane, we used to call it as glomerular basement membrane. So what is glomerular basement membrane? It is nothing but a simple capillary loop. So if you want to remember, you can say it is a capillary wall. Capillary wall, that's it. That tells you what you are having is a GBM. Oh, okay. Now we will try to expand our knowledge of the glomerular basement membrane. So I think that's a very important part. So let's do some very important homework on glomerular basement membrane. Basement membrane. I hope you all know glomerular basement membrane is composed of mainly type 4 collagen. Type 4 collagen. In that it has many alpha chains. Alpha chains can be from alpha 1 to alpha 5 chains. So that's a basic idea. Glomerular basement membrane is made up of type 4 collagen. Apart from this type 4 collagen, we have plenty of polyanionic glycoproteins. Polyanionic glycoproteins. Now importantly, they contain a substance called heparan sulfate. Heparan sulfate, laminin, entactin. So this is found in the glomerular basement membrane. So I want you to now understand that the glomerular basement membrane is made up of these components, mainly type 4 collagen, polyanionic glycoprotein. So what is polyanionic glycoprotein? It is nothing but a type of acyloglycoprotein, or what we call it as a mucoglycoprotein. mucopolysaccharides. Mucopolysaccharides. So I think that's a basic idea. So the question is very often type 4 collagen. Now if you look into it, this type 4 collagen is the one which will be the main filtration pores of your GBM. So that's something which we will discuss again, but that's a basic idea. This polyanionic glycoprotein is the one which offers you the negative charge. GBM is negatively charged. Negative charge to the GBM. How this negative charge is mainly done? Mainly it is due to the polyanionic glycoprotein. Polyanionic. You can write polyanionic. Polyanionic, or just say it is the one which offers you the main negative charge. Now why you should have a negative charge? Very simple. The reason why you should have negative charge is you are mainly preventing the filtration of a protein called albumin from the blood into the urine sample. You don't want to waste your albumin into the urine. So that's why if you are having albumin of negative charge and your GBM of negative charge, both the negative charge repel each other. So that's a basic idea. Both the charges repel each other. That's why you don't physiologically have a condition where that the albumin is not getting wasted because GBM is negatively charged. So that's a basic idea. So why it is negatively charged? It is mainly trying to prevent the filtration of albumin. The opposite is very much true. People who have any loss of polyanionic glycoprotein, like in minimal chain disease, they do have a profound loss of albumin, which we call it as selective albuminuria. Selective albuminuria. So keep in mind, the negative charge is basically protecting the patient from the loss of albumin. So that's the basic idea. And what is the thickness of the GBM? That's a very important question. Very often, what is the thickness of GBM? The thickness of GBM is mainly around 310 to 380 nanometers.